Hello, viewers. Today we're talking about the DNP, which is the Doctorate of Nursing Practice degree, the terminal degree in nursing. And today we have Dr. Sonai Dhir, who got her DNP last year in 2021. Dr. Dhir, can you tell us what your curriculum was like when you did your DNP?
So the DNP curriculum I went for was extension of my MSN program. Also, it helped teach me to promote better healthcare delivery to patients by personalizing care to their social, economic, and religious and ethnic backgrounds.
And then you also said that you took a class on learning how to start your own practice. Can you just tell the viewers how that class was like?
It was interesting because it explained to us how to build up a practice and all the red tape we had to go through to build a practice to make sure it's functioning, and including staffing, budgeting, and all that related to running a business, basically.
That's good knowledge to know, because as nurses, we all want to be our own boss. So good. That's good knowledge to know. Can you tell me the pros and cons of getting your DNP?
So pros would be like you have more respect. You feel that you can be an administrator. Your opportunities, you have a little edge for it, and including you could be in academia or in administration.
Nice. And what are the cons, would you say?
Cons, yes. The cons are that it can be very expensive, and a lot of the curriculum was repetitive from my MSN program. And of course, the cost is also a factor.
Yes, I'm still debating if I want to go back for my DNP. Did you, in your current job, did they offer you more money because you had your DNP?
No.
Oh, that's unfortunate. Okay. And then can you just briefly tell us what your topic was when you did your DNP project?
So we did focus our project on overuse of telemetry. There were many barriers to this initiating the project. Originally, we had a different topic altogether. However, our goal is to reduce nurse burnout and study how overuse of telemetry actually cause alarm fatigue in healthcare workers.
Yeah, because those alarms can definitely cause alarm fatigue. So that's a great topic. Okay. And so Dr. Dhir is a family nurse practitioner who specializes in oncology and hematology. Can you tell me what your day-to-day duties are like being an oncology and hematology MP?
So it's a very intense field, and it's very detail oriented. I actually manage the care, and I see patients with the doctors, assist them with managing their care, and I do symptom management. The doctors order the chemo, and I manage the side effects and any questions they may have. And I also manage their lab review and talk to them about their lab work.
So you see a lot of sick patients. Can you tell me some of the diagnoses you see on a day-to-day basis?
We see a variety of cases in our office. We're in practice actually right now, but I see a lot of like blood malignancies and blood disorders. We see patients who are post, PE, DVT. Also, we see a lot of multiple myeloma, CLL, and we also see a lot of solid tumors such as pancreas, colon, breast, and lung.
Yes, you see a lot of sick patients. To work in hematology and oncology, did you have any training?
I did not have any formal training. I learned on the job and through my own, I actually went out and did CME because I was like, I started my first hematology oncology position last year, and I was like, I have a lot to learn, and I need to find myself a leg up to see, kind of understand the concepts and what I'm treating and what I'm managing in the practice.
Yeah, because hematology and oncology is a specialty. It's not something we learn in MP school. So it's hard work, which she's been doing it for a year and a half. So that's great. And what's like your schedule like?
I work Monday through Friday, 9 to 5 loosely, and every third weekend.
So every third weekend, is that tough? Do you like it?
It can get taxing at times, but it does reserve the continuity of care of patients. I've been following certain patients for a while. You kind of get to know them, and you do build a rapport with them, and you try to convince them to do the best they can for their health.
Okay. And I'm sure you're making a difference in a lot of people who have cancer and who have these blood conditions. And then the last thing, the viewers, you were saying something like as an MP, the advice you would give them is about negotiating their schedule and their contract, correct?
Yes, correct. It's very important to negotiate your schedule and contract because you need to be able to provide the best care, and for that you need to be well rested and happy in your position.
Yep, that's great advice. It's all about work-life balance nowadays. Thank you, Dr. Dhir, so much today for joining Pros for MPs.
You're welcome. Take care.